So, hi friends. So, before I start today's session, I just wanted to tell about this interesting platform that I just came across, that is MBBS Finals. The link is under the description box. Do check it out. So, this will help me with all the answers of my fourth year preparation. So, currently I'm studying gynecology, and while I was studying it, I could easily, I wanted to find out something about endometrial hyperplasia. One answer, it's a frequently asked question. So I just I didn't want to search my textbook and all and waste further time. So I just put the word search here and I found it here already. So you could also check it out. It's a very handy tool that could come aid for your exam preparation. Yeah. So let's begin our 3-mark series. So this is our last year question paper of the RGHS question paper, and here I'm discussing the 3-mark series. So the very first question, that's the red flags and headache. That is Snoop 4 we have, okay? Mnemonic, you can remember. So systemic symptoms or signs that is associated with fever, weight loss, night sweats. Then you should also rule out any history of cancer, HIV or immunosuppression, just red flags. Then that is also a red flag. Then neurological symptoms is seizures, altered mental status, focal neurological deficits, diplopia, hemiparesis, ataxia. So under neurological, remember these 2 points. So write it like a list. You don't have to write the mnemonic because this mnemonic is not any standard mnemonic or something. So just not any abbreviation or things like that. So just keeping in your mind, I've just used this systemic symptoms, neurological symptoms, onset. If like a thunderclap sudden onset, that is a clear-cut suggestive for subarachnoid hemorrhage. Okay, that peaks within seconds to minutes. Then older age group, that's they are had predisposition for more than 50s also, that's a red flag. And giant cell arthritis, the new onset headache in elderly warrants further evaluation. Then there's a progression or pattern change, that's increasing frequency, severity or different from usual pattern. Then worsening over days, weeks may indicate a brain tumor. So that is P. There are P4. Snoop P4 means SNO. You can remember 4 P's. So the first P is over. The second P is papilledema, suggestive for brain tumor or raised intracranial hypertension. Then positional headache, it worsens on standing, that could suggest a CSF leak. If it worsens on lying down, that is again brain tumor or venous sinus thrombosis. If it is precipitated by valsalva, that's through cough, exertion, or even or through sex, it suggests that it is an intracranial pathology. That could be SAH or Chiari malformation, Chiari malformation or a tumor. So this is Snoop 4, okay? You can take a snapshot here. So going ahead. So what are the respiratory causes of clubbing? So I'll try committing the cardiovascular causes for clubbing, because now if respiratory cause could have been asked 1 year, then the cardiovascular could be a potential question for next year. So you can remember with the mnemonic club itself. So it is cystic fibrosis, lung cancer, ulcerative interstitial lung disease, or bronchogenic carcinoma. But I prefer studying it through this story form. So it's clubbing. Imagine a club, you see a coughing person, that is suggestive for cystic fibrosis and chronic lung infections. Then the lung cancer patient, lung cancer itself is also one clubbing cause. Write it there. So that's a VIP guest. The underground has what? Fibrosis and interstitial lung disease. And the bar attendant is serving bronchitis specials. So remember it that way. I mean, you can just try to make studying like this easy and fun. So a coughing person will have what? Cystic fibrosis and chronic lung infections. A lung cancer patient, it's not visible here, or maybe it's he or she is somewhere in the background. They are a VIP guest, so not even seen. Underground has what? Fibrosis and ILD, interstitial lung disease. Bar attendant is serving bronchitis special. So 1, 2, 3, 4, 5, 6, almost 6 causes of respiratory related cause for clubbing. So coming to what is the treatment of UTI, again there's a mnemonic here, AIM P or something like that, but I don't think the mnemonic is needed. See, it's a UTI. So these are bacterial infections affecting the urinary system, causing bladder. The entire UTI is getting affected. It's a bacterial infection. So if it's an infection, what do you use? Antibiotic. As simple as that. So for uncomplicated UTI, you use what? Nitrofurantoin. Then for this fosfomycin is another one. Then trimethoprim, sulfamethoxazole, that's cotrimoxazole you can use. So remember these first line drugs. very important, nitrofurantoin, phosphomycin, and this one, cotrimoxazole. Then for complicated UTI or pyelonephritis, you can use FQs as fluoroquinolones, then ceftriaxone and carbapenems. Okay. Then and of course, if it is a UTI, you have to increase the fluid, you have to flush the bacteria out. So hydration is required, that will help the bacteria flushing out. So I feel a mnemonic here is useless, but like you can just correlate with the like what UTI is, and then just give them in there. UTI infections means what you have to give. For I have to give antibiotics, right? So as simple as that. Then coming to increase the fluids, they manage the underlying cause like any kind of urinary retention or kidney stones, any catheter related issues. So managing the underlying cause is also the need for that. Then pain relief, you can give something called as penazopyridine, important to remember, penazopyridine, symptomatic relief, and short term NSAIDs. If you can't remember, NSAIDs and acetaminophen. They're educating for prevention and evaluate for again any kind of recurrent UTI. So this is the this one, AMP. So antibiotics, increasing the fluids, managing the underlying cause, pain relief, educating on prevention, and evaluating on recurrent UTI. Okay. Then coming to the next question, that is management and rehabilitation of degenerative joint disease in elderly population. So you could remember it like with the mnemonic joints. So for management purpose, so joint protection, lifestyle changes, that's weight loss, reduces the knee osteoarthritis risk. Then O is the oral and topical medications like acetaminophen, NSAIDs. You could give second line. Acetaminophen is the major first line of to remember. Then the second line is NSAIDs. Then intra-articular and interventional therapies. Then non-pharmacological therapies. Intra-articular interventional therapies is like the steroid injections, okay, that is given for a short-term relief. And plasma-rich plasma for or hyaluronic acid in selected cases. Non-pharmacological like physical therapy that strengthens the muscles and joints, and bracing and assistive devices. Then the therapeutic exercises and rehabilitation, that's associated with what? Aerobics and range of motion and strength training. Then surgical management is like the last resort, and joint replacement. Then we have the rehabilitation, that's a move strategy here, okay. That is maintain the range of motion, optimizing the strength, and then the rehabilitation is all about bringing the person into action, right? Bringing the person back to normalcy. So trying your best to maintain the range of motion while stretching, strengthening with resistance and training, then vary activities to reduce joint stress, and educate about joint care and home safety. Okay, so that is the move strategy. You can take a snapshot here. Then coming to ethical issues in the care of elderly, this is an 8com based question. So I think you can write this even without studying. I've just put it here. You can take a snapshot here. Not discussing this. So let's go ahead with the treatment of tension type of headache. Okay. So for treatment of tension type of headache, it is the most common cause of primary type of headache. The second most common cause is migraine. So tension type is the most common cause, okay. And it is like, it could be band-like or it could be bilateral non-pulsatile headache without nausea or vomiting, okay. There's no any kind of aura, kind of manifestation, or any kind of vomiting and all that, okay. So here you can, the major thing to remember is, of course, just imagine a person they have to take adequate rest and relaxing techniques, exercise, the lifestyle modifications, then low dose analgesics, that is again acetaminophen and NSAIDs like ibuprofen, aspirin and all. Then amitriptyline is the main person to remember here. Amitriptyline, very important. That's for chronic TTH. Amitriptyline is the thing to remember. It used if headache occurs in every 15 days or more in a month. Okay, and you have to also prevent overuse of any kind of painkillers, because that could again lead to rebound headaches. So preventing overuse of this painkillers is also the important. So this is how it is. You can take a snapshot here. Remember amitriptyline here, very important. I mean, as a headache, we know analgesics, we will write it even if we do not study. Amitriptyline is something you have to remember extra for, tension type of headache. Okay. So yeah. Coming to what is etiopathogenesis of HIV-related malignancies. Okay, so here again, HIV means we know one thing. It is what all about CD4 cell counts. If the CD4 T cells are, it is getting rapidly declined in HIV. So that is the major the pathology lies there itself. So that because of the reduced cytotoxic T cell activity, that allows this oncogenic bacteria. So oncogenic viruses. The whole question is HIV related malignancies. Virus is the one that's causing most of the malignancies in HIV patients. So just remember the virus and what it corresponds to. EBV virus can cause Hodgkin's as well as non-Hodgkin's lymphoma. Then for HHV8, that causes Kaposi sarcoma. Then HPV8. HPV causes cervical, anal, or oropharyngeal carcinoma cancers, especially the high-risk strains like 16 and 18. Then Hep B and C cause a hepatocellular carcinoma. So remember, these 2 points are more than enough. You can write this as a form of a flow chart itself, like HIV okay, I think I do not need not write it. This self-explanatory. Just put like arrows, that will be very impressive. Because whenever etiopathogenesis, many teachers might be impressed with just writing it as a flow chart form instead of writing like this. So you can put this like a flow chart, arrow by arrow. You just put role of immunosuppression. Then you put another arrow, then viral co-infection, oncogenesis, then chronic inflammation, dysregulated cytokines will further. Again, that will also lead to increased cell turnover and DNA damage, elevated IL-6 and TNF-alpha. That is particularly seen in Kaposi sarcoma. You can put a word here about this also. Then with respect to, since etiopathogenesis, what they ask, genetic mutation, loss of tumor suppression is also seen in HIV infection. So that could result in loss of P53 and RB tumor suppressor pathways. Uncontrolled cell proliferation. Just put a word about genetic also. Okay. So you can write it from all angles. So basically CD4 has to be mentioned and these set of things has to be there in the answer. Again, once again they are telling about HIV related, what AIDS defining and what is non-AIDS defining. Yeah. You can take a snapshot here. Then coming to what is the indications of lumbar puncture. Okay. So it could be like infection. Either you should write it under like as diagnostic and therapeutic indications. Okay, this A, B, C are all for diagnostic purpose. And therapeutic. So under infectious causes, so imagine it this way, like imagine think of the CSF as a black box for your brain disorders, like black box in a plane which records the flight issues, right? After a plane crash, you try to recover the black box to see what happened, right? So here the CSF will tell what's wrong with the brain. It's like our black box tool for the brain disorders. So if there's any associated infections, learn about meningitis, encephalitis, and neurocephalus. If there's any associated nerve damage, GBS, multiple sclerosis. If there's an associated bleeding disorders, SAH. Then if there is any cancer, like leptomeningeal disease or CNS lymphoma, you have to just rule out all these things. Oncological, or if there's any bleeding pathology like SAH. And if the pressure is too high, like in pseudotumor cerebri or increased intracranial hypertension, that is, okay, idiopathic intracranial hypertension, that's IAH, okay. You have to rule out all this. So it is diagnostic for these conditions. So infections, then nerve damage, then bleeding, then cancer, and then if the pressure is with respect to pressure, if the pressure is too high, okay, then it is IAH, that is idiopathic intracranial hypertension. So you can take a snapshot here and coming to what therapeutic is. Under therapeutic causes, you can write intrathecal drug administration like methotrexate for leukemia. And again, IAH, idiopathic intracranial hypertension, that's pseudotumor cerebri, high opening pressure, CSF removal produces symptomatic relief. So here also it is therapeutic. Okay, so you take a snapshot of here as a whole. I learned these are all like diagnostic and therapeutic. Learn like this like, and contraindications could be a question in the potential question like for the coming year for this year's exam. So I just put it out here. You can learn it. So let's go to next question. That is treatment for MDR TB was the question. So I think they asked this question itself to know about whether you are aware about this BPaLM regimen. Okay, that's very important to know this regimen. So B stands for bedaquiline, that is pritomanid is PA, L is linezolid, and moxifloxacin. This is the new WHO recommendation, or this is orally taken. Key points to remember is it's like a 6 months duration it is given. It is a good success rate, and it has fewer side effects. Okay, like compared to like the before, previously we used to give injectable drugs, aminoglycosides and all that. They have like less side effects, and WHO is given preferred this as an all oral MD. All are given orally as an MDR TB regimen. Okay, it is given for a period of 6 months. Remember that also, for 6 months. So even if you don't know anything, just write about BPaLM, you will get marks for MDR TB. Again, here I put up the WHO classification for the second line group of drugs. So you can use BPaLM, and but pritomanid, remember pritomanid is not given here, so you have to write it like under this group A, group B, group C. So just take a snapshot here. Yeah, that's it. Thank you so much. Please, if you like my content, subscribe it, share it with your friends, and learn more.